Today you're going to learn about puberty of the male, understanding your changing body. What you will learn in this puberty class, we will go over what is puberty, what causes these changes, when do these changes happen, what are the physical changes, the male reproductive system, personal hygiene, personal safety, and who to talk to when you have an emergency. What is puberty? Puberty marks the beginning of adolescence, for this is the time when a person's reproductive organs begin to process from becoming mature and functional. The brain is the organ that initiates puberty. You start to develop new feelings and interests. Each person is different, and the changes during puberty will be different for everyone. What causes this all to happen? At the base of the brain is a center called the hypothalamus. The hypothalamus sends signals to the pituitary glands. The pituitary gland is the control center for many other glands, and it releases hormones into the bloodstream that are transported to the sex glands. The sex glands for males are called testes, and they release the hormone testosterone that begins the growth and development during puberty. When do these changes happen? It is important to understand that these changes occur during puberty. They take place at different times for each individual. Your body is special and unique in its own timetable. Boys start puberty anywhere from ages 8 to 15. When you start makes no difference how you develop. Most changes happen in a few years and they happen slowly. What are the physical changes of puberty? There are 5 stages of puberty. There's 1, 2, 3, 4, and 5. And notice the male gets taller, muscles get bigger, and everything else. These next few slides are going to tell what are the physical changes of puberty. In stage 1, it could be anywhere from ages 9 to 13, childhood stage, no visible signs of puberty. Stage 2 may begin at anywhere from ages 9 to 15. The testicle and scrotum grow larger. Fine, straight hair starts to grow at the base of the penis. What are the physical changes of puberty continued? Stage 3 may begin anywhere from ages 8 to 16. The testicle and scrotum continue to grow. The penis grows larger. Pubic hair gets darker, thicker, and curlier. Vocal cords increase in size, causing your voice to deepen and may sometimes crack. Height and weight may even start to increase noticeably. What are the physical changes of puberty continued? Stage 4, you have anywhere ages 12 to 17. You'll see underarm hair appear. Growth spurt continues. Your shoulders begin to broaden and your physique becomes more muscular. Penis grows in width as well as in length. Pubic hair coarsens and takes a triangular shape. Traces of hair may appear in the upper lip, chin. Testicles start to produce sperm. Ejaculation occurs for the first time. What are the physical changes of puberty? Stage 5 may begin at ages 14 to 18. You're in the adult stage, the overall look of a young man. Genitals and pubic hair have an adult appearance. Growth spurt slows down. Facial hair growth becomes heavier. Body hair growth, especially in the chest, may continue into the 20s. The male reproductive system. In these next few slides, you're going to learn about the definition of the male reproductive system. You may want to take some notes or something because we're going to have a test on it and some worksheets on it. The epididymis, a tube in the back of each testicle that carries sperm to the vas deferens, also called the sperm duct. Foreskin. This fold of skin covers the end of the penis. Not all boys have foreskin, but in some cultures it is removed, an operation called circumcision, when a baby boy is only a few days or weeks old. Uncircumcised boys and men pull the foreskin back to wash under the part during daily hygiene. The penis is the male sex organ also used to urinate. The male reproductive system continued. The prostate gland next to the bottom of the bladder. It forms a fluid that combines with sperm and a fluid from the seminal vessels to make semen. The scrotum, the sac of skin that holds the testicles, just underneath the penis. Semen, also called seminal fluid. It is white, milky liquid that carries sperm out of the penis during ejaculation. Vas deferens, tube in which sperm is combined with other fluids from the prostate gland and the seminal vessels to make semen. The male reproductive system continued. Seminal vessels, two glands on either side of the bladder that secretes seminal fluid. Sperm is the male reproductive cells. Testicles, also called testes, two oval-shaped organs that are contained in the scrotum. They produce the male hormone testosterone and sperm. Urethra, the tube that carries urine and semen out of the body, but not at the same time. Personal hygiene. During puberty, your body will begin to produce more sweat. That occurs when the procreating glands located under the arms and in the genital areas becomes active during puberty. When stimulated, like jogging, running, working out, these glands produce a milky liquid perspiration and cause body odor when it comes in contact with the bacteria on the skin. To control this, the first step is to bathe regularly with soap and water, shampoo for the hair. This removes the dirt and oils from the skin and reduces the bacteria that can lead to body odor. Personal hygiene. The second step is to use deodorant and antiperspirant. Deodorant helps you smell good. Antiperspirant reduces the perspiration and underarm wetness, and it helps to prevent body odor before it starts. Body odor can be held by the clothes you wear, so also put on clean clothes after bathing, including undergarments and socks. If you are in sports, it is especially important to bathe, use deodorant, and change clothes after every practice or game. You should be starting the shower 2 to 3 times a day, especially when you wake up in the mornings. Personal safety. If you ever feel unsafe or uncomfortable, just say no. Keep saying no as many times as you need. Then tell a trusted adult about what had happened so they can help you. Make sure to wear proper protective gears, helmets, knee pads, etc. when playing sports and other activities to prevent injuries. When walking alone, always be aware of your surroundings and avoid dimly lit areas with very few people, especially at night. If possible, always travel with a buddy or a parent in public places such as the mall, park, downtown, etc. If you ever have a problem, who should you talk to? There are many possible people to talk to. First is a family member, your mom, dad, aunt, uncle, grandma, grandpa, etc. Second, maybe a teacher, school nurse, principal, guidance counselor, etc. 3 is a doctor. 4 is any trusted adult that you trust. Coach. The end.